Christine said earlier, please put your name and organization in the chat. And also, I guess we're going to move to our icebreaker. Along with that, please give us, since it's Women's History Month, the woman in your life that was most inspirational to you, and what did you learn from that particular woman? So thank you in advance for being here today, and we look forward to hearing and seeing what you want to put into the chat, and for this to be a meaningful, productive meeting as always. Thank you.
And I do see we have some new folks joining us. So Dr. Cooper and Christine, would you guys like to kick us off with introductions?
Sure. Christine, would you like to go first?
Sure. Good afternoon. I am Christine Stewart, co-chair of our Health Equity Workgroup. I work for the Institute for Public Health Innovation, which is the DC, Maryland, and Virginia's Public Health Institute. And I'm a Prince George's County resident as well. Thanks so much. Dr. Cooper?
Yes, good afternoon, everyone. I am Sharon Gibbs Cooper from the University of Maryland Institute for Governmental Service and Research. I do work in the community for the Center for Health Equity, along with the public service for the Institute as well. And I've been a part of the group for about 1.5 years. And I also am a resident of Prince George's County and happy to be a part of this group.
Thank you both. Are there any specific influential women or inspirational women that you want to call out?
Oh, you wanted us to speak? Okay. I'm going to say my mother, and that's because a strong figure, and she taught me perseverance and to be resilient. And so I think those are two characteristics that we're looking at in these unprecedented times. So I'm really, really pleased to share that with folks. Christine?
Would anyone else like to introduce or respond to our icebreaker?
Hello, everyone. I'll go ahead. My name is Sean King. I'm the Office and Operations Manager with CECG. We're a local nonprofit organization helping folks access a lot of different resources. I was thinking the same thing. My mother as well. She's an immigrant from El Salvador. She came here when she was very young, and single mother a lot of my life. So just kind of echoing off of what you said before, resilience and being able to persevere through the various challenges that life throws at us. She taught me that from a young age. And I think also to be very mindful about how others are also going through challenges. I think we have to recognize that sometimes it's easy to just see people at face value, and we get caught up in our own responsibilities that we forget that people are people and they have a lot of things going on in their own personal lives. So we have to remember that. But we're happy to be here.
Hi, good afternoon. My name is Stephanie Burke. I am the program director as well as the associate professor at Prince George's Community College. And the woman in my life, also, I must concur, my mother. She also is an immigrant from a Latino country, and she taught me perseverance and resilience. And that's why I am where I am today and who I am today.
I am going to do the icebreaker. This is Judy. Oops, I got to move you down so I'm not stretching my neck to another screen. I love the fact that we are all valuing our mothers. My mom made me who I am. She was an orphan child, so to speak, and lived in foster homes and many different things. And so when I was growing up, she She got to work in the NSA, and she worked there for many, many years, and then went to work for CIA and was a liaison between, anyway, all the different things. We called her a spy. Um, she was a 4'11", 3/4 woman. She was a tiny woman, but she was always very determined. My husband actually nicknamed her the Little General, and which was very true, very true in how she approached life, and she fought for life, and she taught me how to fight for life.
That's wonderful. Anybody else with, oh, Amira, I see your hand raised.
Hello. My name is Amira Bilal, and I am from the Prince George's County Department of Family Services in the Aging and Disability Services Division. And I only answered because I wanted to answer this question. I have two people. It's my grandmother and my godmother. Um, my grandmother definitely for her resilience and just always doing whatever it takes. I remember so much of what she shared with me. Um, but I remember asking her, like, especially as I grew older, like, how did you do all of this? How did you raise kids? How did you go to work, serve your community? And I feel like, she just told me you can do anything, if you have faith. And that sticks with me. And my godmother, I recently had an experience with her, that let me know how much of a privilege it has been to learn under her tutelage. She's one of the first women that was focused on self-care and mental and emotional well-being. She's a writer, so a lot of people have been exposed to her writing, but to just know her personally, and how much of that she rooted with me, that balance of being of service to others, but also self-care informs my work as I help caregivers and help elders and their families make transitions.
And I see Tanya Henderson from the health department also echoed that her mother is in her inspiration. She was the only child of five and even finished high school and went on to receive a college degree and instilled thirst for education to myself and my siblings. Uh, all these stories of and honoring the women in our lives is inspiring. And I mean, hopefully that's inspiring for any of us to know that you don't have to be somebody famous and in books that millions of people know to know that you do make a difference in somebody's life. And I encourage you to share what you've shared with us with your grandmother, godmother, mother, if you haven't already, because I'm sure they would love to hear that. All right. Dr. Cooper, you're on mute if you're talking.
Okay, today's agenda will cover welcome and introductions, which we have done already. And we have the wonderful subject matter of the county's fiscal year budget overview. And that's going to be presented later or within seconds, I would say. And then we're going to have an open discussion because we know there are a lot of moving parts and people are just seeking information, resources, and answers. So we're going to go into that. And then our next area will be any community announcements that you would like to share. And then we, of course, will adjourn.
All right. And thank you, Dr. Cooper. And just as usual, we did want to reiterate, as we always do, the vision for this group, which is where Prince George's County is a place where everyone has equitable access to achieve their full health and wellness potential, regardless of color, race, religion, country of origin, immigration status, class, age, disability, sexual orientation, gender identity, or health literacy skills. And so with that, I know there's a lot that's been going on. I felt, even as I read that, I felt like that was a statement, very valid, And many of you, based on what work you may be doing in your worlds, there are a lot of things that are happening at the national level, but also we want to take a look, take a moment in this meeting to hone in on what is happening at our county level, so we can know how we show up and what we do. So today we have two presentations. First up is David Noto from who is the County Council Budget and Policy Analyst. And so with that, I will turn it over to David. Thanks for joining us.
Thank you, and good afternoon, everyone. My name is David Noto. I am the County Policy Analyst specifically for the Health, Human Services, and Public Safety Committee, or I'm one of three for it, but I focus specifically on the health side of the world. And is it possible for me to share my screen?
Absolutely.
Okay. Okay, there we go. So.
Oh, you may want to switch. We're seeing presenter view.
Oh, okay.
Always tricky with these platforms.
Let's try that again. Are you still seeing it in presenter view?
Yes, we are.
Yeah.
Oh, come on. There we go. Is this where it is?
Looks great to me. Thank you.
Okay, there we go. So good afternoon. My name is David Noto. I'm a policy analyst. And I wanted to mention that the two women who inspired me the most were my grandmothers, because they always taught me knowledge is proud because it knows so much, but wisdom is humble because it knows so little. And so the value of humility was something that they always tried to instill in me. So some budget dates for everyone to keep in mind. The proposed budget was released March 13th, and it will be adopted by May 22nd, which is really not a lot of time to actually be able to go through all of the different moving parts of this. I'm going to focus specifically on the health side of the world. And so I wanted to emphasize that the Health, Human Services, and Public Safety Committee meeting, where the health department's budget will be presented, is going to be happening on April 28th at, I believe, 2 p.m. You may need to check that last part because these dates occasionally shift a little bit. So this is specifically for the health department. You'll see it's broken down into three parts: the general fund, the grant funds, and then a new thing this year, a special revenue fund. And you can see how the breakdown goes. I'll make these slides available at the end so everyone can take a look-see at them. One thing I wanted to specifically point out under the general fund is that this year, the Health Assures program, which for those who may not be familiar, is a program where folks living in the county who earn 200% or less of the federal poverty level and who do not have health insurance can get primary care coverage at one of our local federally qualified health centers. Gets $1 million this year as a line item. Last year, the program received $4.25 million in ARPA funding. We no longer have ARPA funding, and so there are continuing negotiations for whether that number can be boosted a little bit. especially because the amount from last year, $4.25 million, was not sufficient to cover all of the needs of folks attending federally qualified health centers. So typically the money runs out sometime in, I believe, February. Grants and general fund both have seen an increase this year from fiscal year 25. The opioid program I wanted to talk about a little bit more because it's a new program, supports opioid abatement initiatives. It's getting money from two separate sources. So a direct allotment from the state and an allotment. And then this is, revenues received from the state opioid manufacturers and research associations, and interest shall be held in the fund. Prince George's County is one of 58 Maryland subdivisions that is participating in the national opioid settlements. So here are some key accomplishments. The one that I think is getting the most attention from the health department this year is the launch of the Dyer Care Center, which is the first behavioral health stabilization center in the county, and I think the only one in all of Southern Maryland at this point as well. And then let's see. These are the top priorities, or some of the top priorities, I should say, for this coming fiscal year. I believe there are going to be a fair amount of improvements to some of the online systems that the health department currently uses, and that there are going to be some changes in the management system as well, although I do not have all of the details on some of this. So here is the breakdown of grants by division. As you will see, the Division of Environmental Health and Disease Control really is not getting very much money at all this year. Although if previous years are anything to go off of, it doesn't appear that they're super hard up for, they're going to be super hard up for the cash. I could be wrong about that. You'll see that behavioral health has received a significant increase in grant funding. And then the rest are sort of within more or less standard with kind of variation from year to year, with the exception of the Office of Health Officer, which has received about $4 million less than last year. And there are lots of different programs within the Office of Health Officer, but I do not have a list of all of them with me. So I wanted to speak about opportunities for folks to make comments on the budget. You'll see a bunch of links in here. All of those I will add to the chat after I am finished presenting, so that you will have all of those ready to go. So if you want to address the council on any issue, the regular county council meetings are typically every Tuesday, and you have to sign up in advance, and you are usually limited to 3 minutes to speak. Some tips are, a good thing to do is you just go straight for the topic that you want to talk about. Do not get into your background or anything like that. They are going to want to hear about the issue that you are speaking on. And even if it affects your life personally, get into the details of that and keep it short and sweet. That is oftentimes the best way to make sure that they are paying attention and respecting what you have to say. That may seem a little flippant, but that is the truth. And then the public budget hearings that are coming up are on the county's meeting page. You will be able to find those that get a little bit more into the weeds about different programs. Also, we live stream all of the meetings, and there is a weekly newsletter that talks about updates to legislation. So you can see all of that information if you need to on the website, and it is actually fairly easy to get your hands on. Okay, and so that is all that I have. If you have questions, please let me know.
All right, thank you, David.
David, I just wanted to ask, can you go into depth more about that budget presentation that's taking place on April 28th? What will that look like, and is that open to the public or public comment ahead of the meeting?
So yes, I believe it will be open to public comment ahead of the meeting. I do not know if it will be open. I would be kind of surprised if it wasn't. Almost every committee meeting is technically open to the public. So, and then what is going to take place in that is going to be, hold on. Need to look at my calendar for what the other things are happening that day. So there will be two other presentations that day in HHSPS, one for, I believe, the sheriff and the Office of Homeland Security, and then there will be the health. And I will be the one presenting the findings of the budget to the committee for the health department that day. And the actual part of it that I'm going to do is fairly short. I mean, they really want to keep that meeting moving pretty fast. So I would be surprised if my presentation takes more than 5 minutes. And it is going to be a pretty quick overview of a lot of what I just actually went over with you. There'll be a little bit more in depth. There'll be more information on the slides, certainly. And that's going to include major changes in terms of like staffing. There aren't any as far as I know. And other programs, new programs. So the opioid thing will get a specific mention because it is new. The Health Assures program, because it's a thing that a lot of folks are now getting very anxious about because of potential federal cuts to things like Medicaid, which this is not set yet, but for those who may not be aware of this, the CBO, Congressional Budget Office, has released an initial estimate of what the cuts to the House Energy and Commerce Committee and the House Budget Committee are seeking for that are specifically health related. And assuming for a moment that Medicare is not touched, almost the full burden of those cuts would fall on Medicaid. And they have estimated that over the next 9 years, there would be something in the realm of about $8.8 trillion in cuts to Medicaid, CHIP, and other health programs. And Medicaid's budget over that time period would be 8.5 trillion. So it's almost an apples to apples thing in terms of the amount of money that would need to be cut. And based off of that, groups like the Center for American Progress have made some estimates as to how much that would end up affecting us here in Prince George's County. And they have been able to estimate that, assuming that all of those cuts were to go through completely unchanged, which I think is unlikely, but nonetheless possible, it would knock something in the realm of about 45,000 people in the county off of Medicaid, and would be the equivalent of 2.5 billion in cuts to Medicaid for just Prince George's County. So, as you might imagine, there's a lot of uncertainty and a lot of worry about how that would be affecting things like federally qualified health centers, and how how that might affect wait times in emergency rooms, etc. So, yeah, that's the scary federal budget. I told you I wasn't going to get too into it there, but that's the potential, and so that's one of the reasons why there has been efforts to kind of shore up the Health Assures program, because the expectation is that folks are going to need it.
David, thank you so much, because that was one of my questions. If it's per se that is high, potentially high, what is the contingency plan for the county to be able to help to alleviate some of the loss based upon, access to healthcare and everything else? But it sounds like there is some sort of plan in the works, or some strategies that are in discussion, or I don't know what stage they are in, but
Well,
are you in a position to share?
Sort of. The Health Assures program has been around since 2017, I believe, and there is a work group currently that is trying to kind of sort out ways to ensure continuity of funding for the program, and how to perhaps cast a wider net to ensure more folks could be covered, or to ensure that more health providers are included in the network of those who would be participating. Yes, and as Sharon has just added in the chat, yes, $4 million over the past 2 budget cycles. Yes, that is a pretty significant cut. Yeah.
Are any of the hospitals, local hospitals, engaging in this process, or is it just the
They are
council?
part of the work group at the moment, but not all of them. University of Maryland, Capital Region, and I don't remember who the other one was. Anya, do you remember?
Yes, also MedStar and Luminous, they are part of the existing work group, but even though Adventist is not in the work group, we are reaching out to them because we want to make sure that we have representation and input from all our main stakeholders. And it's the same with federally qualified healthcare centers. Currently, we have 4 representatives in the actual work group, but the rest are still being contacted. How successfully, that's a slightly different question, but we have reached out to everybody because, once again, we want to make sure that all the participants, like all the main stakeholders, that we hear from them as any recommendations are being developed and finalized.
And so I know, Taylor, that and Anya, you had another presentation, and there may be some overlaps, and some of the questions may all kind of wrap in. Do we want to have discussion, or have Anya do her presentation?
Actually, this is our only presentation today.
Okay,
Yeah.
sorry.
Yeah, I don't have a presentation, so I can just add couple of points to David's presentation, as well as helping the audience better understand kind of like what is the budget and how some things work. So just generally, health department's budget typically represents about 1%, a little bit less of the overall general fund expenditures, just to give you an idea how much money is actually being dedicated. So health department's budget, as David has shown with his numbers, is predominantly funded through grant funds. And we also have to be careful in how we interpret the information, because what is being proposed is not necessarily what department will be able to spend. So, for example, grants budget, those are anticipated grant awards. That means that that's what health department is actually planning and hoping to apply. Now, which grants materialize, which do not, we actually do not know, which is also why it may be interesting for the group to tune in into David's presentation, as well as actually to request that report, which is actually publicly available. Like I send a link for fiscal 25 budget reports, which has a report for health department. Those are publicly available documents, but there you can actually see, for example, the difference between what was authorized in previous year and what was actually spent, because sometimes there's a significant difference. Also, information presented in the budget book, for example, when it comes to authorized staffing, has very little to do with the reality of the actual staffing for the health department. And especially nowadays with the difficult budget situation, even more so this year than ever before, it is very likely that the agency may not be eligible to fill any of their vacant positions. So once again, thereby, even though they have a certain authorized budget, they literally may not be able to actually spend it, right? If such restrictions are being put in place. So we also always have to be kind of like, savvy with how we interpret all of this information. And generally the point kind of like of the budget review is, of course, like more in-depth review, which is what David will be doing, is to look at the trends, right? What is happening, and generally try to figure out what are the operational needs of the agency, and is sufficient funding actually provided to meet the operational needs of the agency. So we have to kind of like try to have those honest conversations as to, like what is actually needed and what are the challenges. And sometimes when you start discussing, like, okay, like what are the needs of a particular division, or, like what is the performance of a particular program, that's when some of those issues may come at play. So for anybody who is interested, that's why we wanted kind of like to include information as to how people can actually actively engage with the legislative branch, which is the county council, which are ultimate decision makers. So county executive proposes the budget, but then it is up to the county council to review it, to approve it, so they can actually make changes. And so that's where community's input is always valuable. And once again, the squeaky wheel sometimes does matter. I mean, we always encourage people to just voice their preferences and their opinions on whatever is being considered by the council. And of course, budget is one of those things. And as David mentioned in his presentation, in addition to testifying on budget, there are other opportunities throughout the year to engage and to provide input, especially when some kind of health-related legislation is being considered. And honestly, if no health-related legislation is being considered, and maybe it should be considered, you can still come and testify. If you feel whatever issue you feel strongly about, once again, as a resident, you have a right to come and address the council. So if you have any questions, let David and I know. We're here. Thank you so very much.
That's a good point. I wanted to mention one thing. So generally speaking, the budget, about 60% of it goes to the Board of Education. And then an additional 20%, I believe, goes to public safety. That means that everything else gets that 10% sliver of the budget, all the other programs. And historically, health departments tend to operate on boom-bust cycles. So when there is a public health emergency, there'll be a lot of money that gets thrown at the health department kind of after the fact to fix it. And then once that public health emergency goes away, they go back to being put onto starvation rations. And so that is pretty typical nationwide as a trend for how health departments get funded. So something to keep in mind.
see Sharon's hand was raised. And thank you, David.
Yes, I just wanted to make a plea related to the Health Assurance Program. As you know, I work really closely with the federally qualified health centers in Prince George's County, and this is a very uncertain time for everybody related to healthcare. And I don't want to sort of miss the human aspect of what is going on here. So just under 200% or less of poverty level is roughly $30,000 for annual income per year for an individual, and roughly $60,000 for a family of four. So it's really talking about people who are living on the margins, who aren't covered. And then we guesstimate that there's roughly 65 to 67,000 people who are excluded from subsidized insurance because of their immigration status. And these are generally the hardworking people you see who are working 2 and 3 jobs to keep their families alive and well. And without the subsidy for health assurance to the health centers will have limited capacity to serve all of those people who need it. And the end result is you don't have a healthy workforce. You have kids who aren't getting the vaccines and other care that they need. You don't have thriving communities, and you have hospital ED waits that are going to get even longer than they are already. And Prince George's County has the longest emergency department waits in the entire country. So it's you can be penny wise. I know it's a tight budget cycle. You can be penny wise and pound foolish in a lot of ways. So what I'm asking people to do is, even if you don't want to go and do your 3 minutes of testimony at a budget hearing, you can write to your council members expressing your concern. You can submit written testimony in support of increasing the funding for health assurance. And just to put it into perspective a little bit, we estimated that it would cost $10 million to provide basic coverage. And this means, basic primary health care for the number of people who need it now. The program during COVID was funded at $5 million with ARPA funds, COVID and ARPA funds. And the county did depend on the health centers to ensure that people were getting vaccinated, that people with COVID were being managed properly, that people were educated and knew how to prevent spread. So the health centers play not only a role in providing service to the individuals, but also a role in supporting the public health infrastructure. So it's really, really important. And if anybody has questions, I know that Anya and David, who've done such a great job, are limited in what they can say. I can say anything. So please feel free to ask questions of me if you want to know how to advocate. If you need additional information to advocate, I am happy to share whatever I have. And I see Rodrigo is on the line too, and he may have something to say. He's from La Clinica. Thank you.
Well, just to compliment Sharon, yeah, I think I have nothing in terms of the data and like the human face and the human impact that Sharon provided. Yeah, so just echoing every word Sharon said, because I couldn't add more than what she said. Just the impact and the importance of that primary care to prevent more costly complications down the road as well. That would be my only. This is an investment in actually a reduction in cost down the line as well. So, but yeah, thank you, Sharon. That was.
Oh, I see.
Anya?
Okay, thank you so much. Just also wanted to chime in, kind of like Sharon's comments made me think about just the importance of civic engagement in Prince George's County, because also remember that, these are elected officials.
That's right.
They have fiduciary responsibility, right, to spend the money. It's your money, it's our money, we're the residents. So oftentimes residents can play a very key role as those oversight pushers who come and who say, hey, such and such is an issue in our community. What have you done lately? What exactly is health department? Health literacy is an issue. Well, what is being done to address that? Do all residents know what services are available to them, either through health department or through health department contractors or from all the nonprofits? Are we expected, is individual persons supposed to navigate, what a gazillion of nonprofits in the area, or will all they be consolidated and we can actually have online access to explore the resources? Behavioral health is an issue. Well, what do we know about how, in terms of availability of providers, in terms of diversion from public safety? Once again, whatever it is that you're passionate about, remember that you're not just coming to ask. You are there to basically serve as a part of checks and balances. It is actually, it is healthy to have active civic engagement. And unfortunately, compared to other jurisdictions, Prince George's County is far behind, which is also why I actually think that Healthcare Action Coalition is just such a gem, because there are so few organizations that actually keep tabs on certain issues and have the power. Because I know when we do some work as the Board of Health, we actually refer to you because you literally keep certain issues alive, allowing us to go back to them and say, hey, this is what community wants. This is what community expects. So I just wanted to acknowledge that. Thank you.
And I
Thank you,
think this
Anya.
is a good opportunity for us to understand that the scope of what we do has many, I would say, pillars, and one of which part of our voices being heard for through the lens of those in a community will entail advocating, as Anya had said, and being that voice to those decision makers, legislators, and keeping them apprised of what's going on and holding them accountable as well. So I think that's something that's going to be very important as far as one of the pillars of this particular group, one of many. Taylor, yes.
I'm just curious, we've talked about at the local level, the national level, but not to add insult to injury, we got to bring up the state level, the state deficit. So I know the education sector was looking at being the hardest hit by state deficits with the blueprint for education. I think it was assumed maybe up to $15 million would have to be covered by the county if that budget was passed with cuts to the blueprint. So curious if there are any projected cuts at the state level in terms of health and human services that the county is anticipating, beyond Health Assures, of course.
That is a good question. I do not actually have an answer to that. I can tell you of one program that I am keeping my eye on as a possible way to help alleviate the state level budget shortfall, which is the proposed tax on sugar sweetened beverages. For those who may not be familiar with it, it is proposing a 2-cent per ounce tax on every sugar sweetened beverage. And they are projecting, I think, a slightly rosy outcome for the amount of money that they would be receiving. I believe that the Department of Legislative Services put it in at something around 400 million that they would receive annually. Like I said, I think that's a little optimistic. However, there are multiple health aspects to this particular piece of legislation. Not only is it going to would it help alleviate some of the budget shortfall, it would put 189 million into a healthy school meals for all program to help provide free school meals to Maryland students, especially at a time when we know that the Department of Education is also potentially facing not just cuts but elimination, and USDA is potentially facing significant cuts to health related or to meal programs as well, which will have wide-ranging health effects. And beyond that 189 million to free school meals, I think almost all the rest would go to just general fund coffers to shore things up. I do not know the status of that bill. It has been referred to committee, but I do not know if it looks like it doesn't have the greatest chance of getting passed. So if that is something that you think would be a good idea, I would suggest writing to your delegate and state senator to support it. So
We mentioned
Thank you.
writing and advocacy for those who don't feel comfortable in speaking in public, but another form, as Anya had mentioned, was writing to our legislators. Is there a formal template that's being used to be able to communicate and articulate what we would like to say so that it's concise, yet it gets to the point, and it could be addressed during, legislative sessions or whatever the protocol is, but is there a template?
At this point, there is no template. So, and while verbal comments are limited to 3 minutes, written testimony has no limit. So literally it's, like it's whatever you want to say. And I know David has already provided a link to the website, which shows how to sign up as well as how to provide written testimony. And I would just add that every time you provide written testimony, obviously like you can send it, follow the whichever directions are there. Feel free to CC that communication straight to the council chair, straight to the council vice chair, straight to your own council member, as well as to all the at-large members. If you want to, have a wider net, you can also consider since if you take time to actually write a testimony, you can also consider sending a copy of your correspondence to some of people in the executive branch as well. So, but I would say that it's kind of like free flowing, just I guess like using known best practices in terms of, make sure that people understand what it is that you're trying to say, and and why what you're saying is important. So, but there is no template as such at this point. So I would just write it as a professional letter. And
Thank
also,
you,
if this
Sharon,
is
for
something
adding
that,
some detail. Go ahead.
sorry, if this is something that the group is interested in, perhaps this is something that we can work on if people think that it'll be helpful to have a template. But generally, I think it's kind of like, whatever you feel is, you want to say.
Would it be more, and I see Sharon, I do want to acknowledge your hand. I'm also asking, would it be helpful to do one sign-on letter? And that's has the weight of multiple organizations. That end, maybe even our own individual, we can speak as a resident as well. I see some nods. It's just something I'm throwing out, but Sharon?
Actually, I had a slightly unrelated question, related but unrelated. And it's about the school budget. Prince George's County has no comprehensive school-based health centers. And I know that there was funding from the state that I don't actually know what happened to it. It got complicated to try and trace that back. But is there funding within this? And it comes from the State Department of Health, but it goes to the Prince George's County Department of Education. Is the budget showing any funds in this area?
I can get back to you on that. I don't have that immediately available to me, but I should be able to find out. And yeah, you're right. The there was money that was set aside for that, then they weren't unable to find a vendor last year to provide, and so it was this one, and so it's a bit of a playing pin the tail on the donkey to try and find some of those resources sometimes. So if I will do my best to find those, and I will let you know. Okay.
Thank you. I
And
would really appreciate that because that's such a, given all the changes that are going on, it's such a, it would be such an asset if there were
Oh yeah, absolutely.
and just to add to David's response, so actually this year Board of Health is following up with the school system on school-based healthcare. So we have asked some questions initially, and they did come back, and basically, yes, those 10 school-based wellness centers, they're completely inactive, even though they are funded for current fiscal year. They are funded, right? So there is funding in the budget. So as David said, they're having operational challenges and actually finding a vendor to actually run those centers. So we have asked another batch of questions that pertain once again to school-based provision of health services, which includes school-based wellness centers, but actually goes beyond that to all different ways that schools can provide healthcare. So we're actually currently waiting response from the school system. Pending on what those responses look like, we would like to have a Board of Health session that actually addresses that matter. So once again, we're kind of like working on that behind the scenes. So, but it is on our radar, and I know that it is on the radar of some of the council members. And once again, that's a wonderful thing to come and ask your elected officials about.
So just a little bit of a follow up on that. So if there's money allocated for this year and it's sitting there, does that get clawed back? Could that be pushed out to fund, the health centers to cover some of their pediatric services? I mean, I don't know.
If last year was any indication, then the short answer is no. That money stays within the Board of Ed,
Okay.
within the Board of Ed's coffers, and then they need to make the council aware of when they are transferring money within their own sort of budget categories, but there aren't really levers for the council to object. That makes sense. It's sort of just a rubber stamp at that point because the council has 30 days to approve any transfer requests from the Board of Ed, and they typically aren't easy to object to because it's a big part of a bigger swath of changes, and so as long as they stay within the set budget, it's usually just okay.
Thank you for that. I didn't mean to take us into the weeds, but I did.
No, I mean, I'm so happy that you because I didn't know that there was nothing. It's helpful that we're having this detailed discussion. And I think also Anya raised a question that was resonating in my mind because I wanted clarity on who has the budget and the monies for the school-based health centers. And it seems like the money is with the education system and not health. So what you proposed, Cheryl, would be more difficult because the need is there. There's the walls, the walls. And I know in other counties in our region, it is school-based health centers are operated by the health departments. If we wanted to propose a change, how would we go about doing that? Because
Actually, in other places, there's usually like a hybrid, right? So that there's like you would have a combined. In some cases, it's a combined positions or something, but the health departments have a major role because they know how to run they're more familiar with health services, whereas the Department of Education struggles with trying to fit health into their educational guidelines and requirements. It doesn't quite fit well. So that's part of the reason for struggles.
And I see Judy as a comment, and I've seen where it's operated by the school system, but it's really staffed by health department staff. I
It
think
really is,
that's what
as Sharon
Fairfax
was saying.
does.
Oops, I'm sorry. It really is all over the board. I sat on the state commission, and we could talk to Mark Luckner about it. I'd be interested to hear his viewpoint on it. But there are across the board, there are FQHCs across the country that are involved with school-based health centers, all over the state. And so I would encourage us to understand what really happened without getting in the weeds too much, but getting into the weeds as far as finding out what really happened with the schools and how they approached it. Because my sense is, I don't want to speak for the health centers, but my sense is that if we had talked with them, there would not be a lot of no's going on. I could be wrong, and of course Rodrigo could comment to that. But my sense is that it may be beneficial to understand why it didn't get spent and what happened. And I want to say that as respectfully as I possibly can.
Just to let you know, the FQHCs some were interested. The operation of a school-based health center by an FQHC is complicated. It has a whole set of rules and requirements, from everything from the facility to the type of staffing to who they serve. And so it's not like just setting up another clinic. You have to comply with a whole lot of federal requirements, and then whatever requirements the state puts on top of that. So I would say, and I don't speak for the FQHCs, but I would think that there would be interest, but that it is a process that takes planning and time for them to even try to implement something. So I just wanted to put that out there so you have a better understanding of the context around the school-based health centers program.
One other thing to keep in mind is that some of the FQHCs actually currently do have a certain amount of interplay at some schools. So I know Mary Center and I believe La Clinica both do some work with some, it's a small number though. It's only 4 or 5 schools max. We have 206 schools throughout the county. I mean, that's, yeah, not great. So, and oftentimes those folks are only there maybe part-time. And so I do not have all of the details for how those different agreements between the FQHCs and the element and the schools work, but there are a couple that have some interaction, but it's not many.
Yeah, I'll just complement with the type of services that are being provided. For La Clinica, I can't speak of Mary Center, but we do provide mental health services for youth at schools. So we have our Mi Refugio program at Northwestern High School, and I can't recall the other primary schools where we had grown to, but it's mostly mental health counseling that is being provided. And as I said, I'm not familiar with what Mary Center is providing, but that's sort of the work that La Clinica is doing.
It's very similar. Also, I think all of the schools are in the north of the county. So Central and South County have none of those programs. It's all up in the northern part of the county.
Right. Yeah, that is interesting. I know we've talked about two specific budget related issues, so the health insurance and the just the fact that there's those school-based health centers, or there's nothing in operation, even if they're funded. I did notice that there's $4 million less projected in the Office of the Health Officer. Do you happen to know, I know it's just projections, what that could potentially impact? What sort of programs? Is it direct service? Based on so I think these were grants that you mentioned. So it seemed like there were almost, at least sizable projections for decreased funding for family services, environmental health. But the Office of the Health Officer, I saw 4.3. Was that million? Or did I see that wrong? It is 4.3 million. So
Yes, that's correct.
that's a lot of money. Yeah. What do we have a sense, or do you have a sense, or anybody here, since I know there are many health department staff, what programs and direct services that could potentially impact in the county?
I don't. I wish I did, but I can find out and I can pass that on to Taylor, and she can pass that on to you, possibly, if that works.
Okay. 'Cause yeah, I'm just curious. I mean, that's a lot. And if there's anything that we as the work group can do to advocate, or at least, or even just be prepared for, it would be good to know. I saw a hand. Oh, Sharon.
It's mine again, of course. I know that uh, Caitlin had mentioned that the grant for community health workers, I think the county employs several community-based health workers, and they have some of them placed at the health centers and at hospitals and other places. I believe that, and I don't know if it's included in the 4 million, but I believe that grant is ending.
Yes, that would make a lot of sense then.
And that there is no money.
Yeah.
No money has been budgeted to continue the program. So, I mean, adding insult to injury is the idea that you're cutting health insurers, and then there's not going to be any community health workers placed in the community to work with folks who are going to be desperately looking for health and other support services.
I don't know if that's all
I
of it,
see.
but that's certainly a lot of it. That's about
That makes
3
sense.
million.
Yeah, it makes a lot of sense. And I see Judy's hand is raised, and I know you likely have some insight in terms of financing for CHWs.
Yeah, I do. Fortunately or unfortunately. Yeah, it's called the it's called the CHIS grant, and
Yeah.
it will be sunsetting in August. However, there are folks in the health department that are looking for ways to have sustainability for the program. There are, at least through Medicare, not through Medicaid in our state, but through Medicare, there are ways to have to be able to pay for some of that work. And the county is, the folks from Prevention Link and the health department and so forth, they're looking for ways to maybe collaborate either with FQHCs or with other primary care practices to be able to make it sustainable. So that way, it would go under and right now there's an umbrella hub as it relates to diabetes, diabetes prevention, and possibly go under there. There's a lot of work and thought being done and taking and looking at it. So because it really is needed, but finding a way to have it sustainable without it having to live under a grant is what they're trying to look to do, if that makes any sense.
Yeah, and I think what you've mentioned is impacting. So that CHIS grant is sunsetting across the country. So that is a major threat to a lot of community health worker funding that was more flexible. Um, uh, I I can speak more to Virginia, but yes, I mean it is sunsetting. So that is another threat that we need to be aware of. That's impacting health is going to impact health equity and outcomes of the clients, the people, the community that many of us serve. And so I know it's 4:06. I know we had a lot of discussion. Is there anything that we're interested, particularly that we want to collectively take action on? I know there's some things that we're all encouraged to take individual action and advocate. Um, and I'm looking at my co-chair. Is there something that we collectively as a work group want to do about any one of the issues that we've raised today? And I'm sure there'll be others aside from our individual action.
Well, I think as wellness champions and advocates, I think we definitely want to be a part of uh, any sort of hearings and any sort of advocacy work. Um, and we're going to also look at how can we look at expanding our partnerships. And folks have said the hospitals are involved. What can we do to reach out to those other hospitals that, or maybe other providers that may be essential to this particular process as well? I mean, our goal is, we're looking at so many cuts here. How are we as a work group going to work towards contingency plans in helping to bridge those gaps and just exploring opportunities and possible resources? And maybe it's in the, looking at the realm of foundations. I don't know what it will look like, but I think it's time for us to, as we've been doing, be even more creative and look at ways that we can collaborate with other community stakeholders and partners to help just alleviate some of the issues that are down the pike with these imminent funding cuts.
Absolutely. And I see a concrete proposal from Sean King in the chat. Can we submit a cohesive letter with signatures from organizations in the work group to push for more health assurance funding? Does that sound like something the collective group is interested in putting together? So one sign-on letter on behalf of the work group.
Yeah, I just wanted to throw that in there. I'm actually a Montgomery County resident myself, but we operate in Prince George's County. And on the Silver Spring side, I'm the co-chair of a East County Health and Wellness Group, and they work with the Montgomery County Food Council to submit, I'd say maybe 3 letters per quarter about different bills and budgets and whatnot. And we, to have a document with, 30 organizations who sign off on it, I think is pretty impactful.
So, okay, I see some thumbs. I see at least 3 thumbs up. I also
Sean,
see
can we
Anya.
draft you to help us compose this particular letter?
Yeah. I have access to some previous letters, so I can work on one. Um, it's not just the health assurers really, right? So there's a couple things that I think but I guess they could be separate letters. So maybe if I can work on the health assurers one, give me now, does this group meet monthly? Remind me. Okay.
Yes.
Okay. So I can definitely work on one specifically for health assurers, and I can communicate that with Christine and the co-chairs of this group. I can get a draft of it going by next week.
Wonderful. All right. That's wonderful. Thank you. I mean, this I saw somebody was about to talk or speak.
I did just have a quick question for David and Anya talking about timeline. If we should put a hard deadline for submitting any of this information, when it would be best to submit by.
Ooh, that's a good question. So the budget needs to be adopted by the 22nd of May. That is a pretty hard deadline, although I know that there's going to be a fair amount of whipping for, more money or more, support for certain things that is going to be going on behind the scenes almost to the very last minute, if previous experience is anything to go by. So I don't have a solid answer for when you should be done by, but generally speaking, as long as you make your voice heard, I think that that's probably the best thing to do.
And I would say starting now until early May, because if you start now, then council members can know, okay, I actually need to make sure that my staff goes to, like health department's staff review. Okay, we have heard all these issues from our constituents. So when David actually goes to present his report, some council members can piggyback on the issues that community has raised prior to that meeting date, and they can say, hey, we want more information on school-based wellness centers, or we want more information about health assures, or we want to know. So I think actually really starting from now, and ideally before David's presentation goes in, because once again, they can know that this is the area that they need to focus. Because when you are overseeing operations of 50 agencies, it's difficult to be an expert in everything. It's very, very difficult, almost impossible. So once again, if those issues are raised, they will know that they actually need to pay attention, that this is something that they need to follow up on. So they should have notes. And they know, okay, when we see Dr. Levy as he presents and speaks about the budget, we need to ask him about such and such. So that is important.
And sometimes council members don't always send their staff to the staff review to actually hear about the question. So probably a good idea to kind of let them know, hey, this is an important thing. And so just at present, the health staff review is going to be taking place in early April. So we've got about 2 weeks.
But that's not public though, right? Staff reviews are not public.
No, they're not. But you can nonetheless let your council members know, hey, we want, on the earlier side. So yeah.
And so we can work towards making sure that our voice is heard before, so it's raised and it's on their radar, and
so that they can,
send their staff to the staff
so
reviews.
Yeah.
Okay.
And that's actually another thing that I know that the resources that we went over today, that they focus more on when there is an event, right? So when there is a public hearing, when there is a committee work group. So when you have something to say, and there is not a meeting that is conveniently allocated, right, for you to actually come and provide your testimony, you can always email. You can always email your council members directly and let them know, put it on their radar. So there is really nothing that precludes you from that type of conversations and that type of communication. I think that what we spoke to focused more on public engagement, probably publicly speaking and then submitting testimony. But I think what we're discussing right now, we are really talking about sending emails, from constituents or from, nonprofits or whichever groups that operate in the county. So that's slightly different, and feel free basically just to email.
Now, also, during Anna, just to piggyback on what you have said, they also have town hall meetings. And like you said, you can submit your questions in advance, or you can actually voice your questions during the course of the meetings. And, my council person sends out information. So I'm pretty much in tune to when they're happening. And if I can't make it, then I circle back to, like you said, making a call to the office or emailing or writing. So yeah, any opportunity you have with your town hall meetings, use that as a platform to open up the, the ears so that they're hearing that this is an issue. And if, the more information you can provide as far as quantitative information, the better.
And I will also add that on my end, just like as a Board of Health, who am I? Oh, advisor. We have a Board of Health email address as well. So people can actually email that address or they can email me directly. And honestly, I mean, like, I read what people say and I follow up. Like right now, we have a legislation, which is wonderful, that we're working to remove zoning restrictions so that we can actually have opioid facilities in our county that don't have to jump through hoops. I mean, like, that was a major, major cost prohibitive barrier. And it all came because of that type of communication.
Sean, do you have something to say?
Yeah, sorry, very quick. I think I heard David mention earlier that $10 million would be the kind of the required amount, or maybe the floor, that would really be able to serve those who need service in Prince George's County. Did I understand that correctly?
Sharon mentioned that. I actually, when I did the numbers crunching for this program a year or so ago, I had an even higher number. So yeah, Sharon had said 10 million, and I honestly, and then I honestly think it probably could stand to be even more. Yeah.
Gotcha.
10 million
Maybe more.
is bare bones. 10 million is bare bones. It's really just covers the program for the whole year, because right now the funds do run out in January or February. But I think it's really important when we're thinking about what we have to be definitive about our ask, but we also have to be realistic about our ask. I guess the question is, to go out of the box and ask for $10 million, which was a higher rate than Health Assurance has ever been funded at? Or do you say at a minimum they need to do maintenance of effort? You request maintenance of effort at 5 million. And I think that that's a judgment call based on what else we know is going on in the environment and the budget. I would love it if we asked for $10 million, but it just may be unrealistic at this point.
Yeah, and keep in mind that there are a lot of other folks who are, going to be fighting very hard for as many, bits of the pie as they can get. And so it may be quite an ask to even split even.
And is the council responsive to cost saving? So I mean, spending this amount of money on preventative care will save X amount. Because I think that's, like, yes, we understand it is money, but you're gonna pay for it anyway. It's whether you plan for it or you face it down the road.
That's a
I
really
don't
good
know.
question. That's a
Yeah.
really good question. And the short answer is because we don't know what the effects are. Like if we had a study that was done by, say, the University of Maryland School of Public Health, and they were able to game out how much this would save us over 5 years, 10 years, et cetera, and show that this would lead to X amount of savings in terms of how many fewer EMT rides or ambulance rides there would be, how much shorter the wait times and emergency rooms would be, and so on, then it would not surprise me if more folks would be willing to kind of fork out for it. But at the moment, I don't know if there is. I see Amber, you say that there is research like that out there. Please send it to me.
I'll
Yeah,
see
I'm
if I can.
wondering.
I'll see if I can find it. And then also, if you think about the level of chronic disease in Prince George's County, that's compounded by that fact of the preventative cost savings. So we can mention that as well.
And I see, Sharon, you were trying to share a physical report, but your it wasn't showing.
The most comprehensive I have seen is the Huron report, but I don't know that takes it. I mean, the Huron report recommends billions of dollars in investment in primary care infrastructure. I'd have to go back. I haven't looked at it in a bit, but it lives right next to me. That's why I had it. Um, it I don't know that it carries it out and gives you the return on investment and cost savings. Anya, you're shaking your head. You probably live with this report sitting on your lap too.
I said, I don't think it does it. This is Deborah from the health department. I've read that Huron part, and a lot of it is just, again, how to invest in, the investment into primary care infrastructure in the county. It doesn't necessarily talk about preventative care and in really any huge amount. I think that was probably a limitation of that report, to be completely honest, because I'm surprised that there wasn't more about kind of the preventative care or primary, and preventative care aspect of building that infrastructure. So I think, in my opinion, I think that was probably a limitation of the report, but it would have been helpful to have that amount in there.
And I think this is not a problem that is isolated for the health assurance program. I think it is just public health in general. Sometimes it is hard to quantify the cost savings for prevention. But Amber, I see there's something from UNC. Okay.
Yeah, at this point, this research is a little old. I feel like I had something more recent, but I have to keep looking. Is there any literature that's coming from that Health Assures work group so far?
Not yet. It's probably too new to have anything like that.
I mean, is the idea health assurance specifically, or is it ensuring that people have access to basic healthcare coverage, and that access will help prevent diseases? So, I mean, can we translate? We know people who have access to healthcare and actually are health insurance are using it. Using it.
Well, I mean,
So
there is a program in Montgomery County that is much more diverse in terms of the amount of services it offers. It's a hell of a lot better funded. And it has different program types that it has within kind of a greater umbrella. So there is a possibility to use some of what they're doing in Montgomery County as a how-to guide, I suppose. But that's, still kind of a ways out.
It's so funny that we talk about this and where folks are entering the continuum of care, and hospitals like the University of Maryland health systems in the capital region, they're looking to divert people. They want that preventive care, that primary care focus. So I think we need to have them at the table as well, because again, when we look at short-term versus long-term cost and continuity and coordination of care, that's where we're having major gaps. So how do we address this? So, they recognize that they can't work in a silo, that they have to work using a collaborative approach. So I think it behooves us to have hospitals at the table during this conversation. Sorry.
I mean, and not only hospitals, but I mean, who's then impacted by people who are not healthy, the workforce. I mean, it's jobs, there are a lot of people, a lot of organizations, companies, not in our field where, people not showing up. There's already a problem getting people for certain positions, but if a good portion of your workforce isn't able to come because they're not ill, they're sick, that has an impact. I don't know if I mean, that's part of the health and all policies approach that I think we still kind of need to. It's not just the health. The benefit is not just for the health system. So I think I want to make sure that we don't lose sight of that when we're talking about partners and who we reach out to. But I also see that we're at 426 Taylor's, and I know there are probably some community announcements.
Yes, and I just want to make sure for our notes purposes that we're clear kind of on our next steps and timelines for things. So if we're looking ahead at that early April staff review, is it something where there could be a draft letter put together to put it on the radar of those staff members and then, work in the background in the next few weeks and be able to get this plan together, get the data put together? Is that enough from your experience, David? Or, again, kind of going back to what we should be aiming there. I want to make sure that we're realistic and when we can get this effort put together.
Remind me again when your next meeting is?
So our next monthly meeting won't be until April 17th.
If you were to have I mean, yeah, I think that you could absolutely have a group letter or something like that done in that time that you could then share out that would, yes, make it to the council members, I think, in enough time. Anya might know better than I, but that would be my assumption.
Okay. And so with that, that internal staff review meeting, is that something that we need to have on our calendar as well in terms of getting together, again, just a high level? Okay.
I don't think so. Yeah, especially since those things can be subject to change. And since they are not open to the public, so yeah, I don't think so.
So one of the things that I was going to suggest is we could do the letter, circulate it, and finalize it at the next meeting, if that makes sense to folks.
Yeah, that sounds good to me.
Rodrigo's hand. And is that too late in terms of, because I also noted that I thought we were trying to focus on getting a letter in front of council so that they can ensure that their staff are going to the department staff reviews. So I mean, I guess it all depends on what's important.
Yeah, I think if we're aiming towards early April, I think we could have it drafted up before 2 weeks. I think I could definitely draft it up by next week, and then hopefully we can start getting signatures the week after that. We want to get it out there sooner than later.
And if we need to have an ad hoc meeting, we can schedule something before the next monthly meeting for anyone who would be interested in contributing.
And it's definitely a good practice for council members to sit or to send their staff, like their chiefs of staff, to staff reviews. But I would not really get into, it's like telling them how to do their council work. I'll really focus on the issues, like this is what's important for us. This is why it's important. This is what has been done to date. We want, you know what I mean? Like more like that. I would focus on matters of.
But still timing it ideally before, so the issue is on their minds, and then they can send their staff. Yeah.
Ideally.
Mm-hmm. Okay, so it sounds like so thank you, Sean, so much for drafting and taking the lead. We'll keep an eye out on our emails. Do you have, so I mean, Taylor's usually put through the PGHAC, but do you have point of contact?
I
Let's take care
have,
of that before we leave.
I have pghac@co.pg.md.us. That
Yes, and
if I send
that's
it
the
out to that
coalition
one, does it
email.
go to everybody?
It won't go to everyone. It will go to me, but I can make sure it gets to everyone.
Okay, awesome.
And I'm sorry, I saw Rodrigo's hand earlier. I just wanted to make sure if there was something that he needed to mention.
No, I confused the hand with the emotion. I wanted to do a thumbs up, but
All
Hey,
right, so
sounds
I know
good.
we're over time, but
Yes.
thank you. I think this was a fruitful discussion. Thank you so much, David and Anya, for your contributions. I think this was very, very helpful for me to have this understanding. I think every time I hear from you, Anya, definitely, because you've been participating in these meetings for a while, I learned something new about the process and how we can show up better. Community announcements.
Yes. So first announce the Maryland Department of Health Office of Minority Health and Health Disparities is hosting a grant writing workshop taking place on Tuesday, March 25th. I will include this in our meeting note with the registration link. This will be a virtual session. They'll go over the fundamentals of grant writing and then continue the session on Wednesday, June 11th. Next, an approaching deadline coming up on March 31st for the Summer Youth Enrichment Program, one of the programs that is actually funded in our budget that you'll see if you take a look at our general budget, but available for county youth ages 14 to 24 to get some summer work experience. There's a $500 stipend available for students who are interested in this opportunity, taking place July 1 through August 8th. So I will include the link in the meeting notes for folks to apply to this program. But if you have access to any Prince George's County youth, please share this opportunity with them. Next, I'm going to put here in the chat. The Prince George's County Health Department is excited to launch the community resident survey to inform our community health assessment. The survey is available in English, French, and Spanish, and it will be opened through April 6th. So I've included those flyers in the chat, and I'll also make sure those go out in our meeting notes. But if you all could share with your networks, we want to hear from as many Prince Georgians as possible. It is available to anyone who lives, works, worships, studies in Prince George's County. And so again, want to make sure that we're reaching as many folks as possible and could really benefit from your sharing. And then lastly, two sessions that took place last week wanted to highlight from our library system. They had a wonderful community conversation about immigration challenges here in Prince George's County and making sure that we are protecting our Prince Georgians. And the sessions were available in English and Spanish. So I will include those two links with you all. Some really great county level resources were shared during the meeting. So want to make sure we get those in the hands of as many Prince Georgians as possible. A really great follow-up from our last meeting when we talked about this ongoing dilemma in our community and how to best support folks. And then lastly, as Temi was leaving the meeting, she dropped this in the chat for us. An opportunity here with Luminous Health celebrating 50 years on Saturday, April 12th. So a wonderful opportunity. I believe it's related to child and maternal health for folks to come out, and I will make sure this flyer reaches you all. That was really abbreviated, but I want to give time if there were any community announcements that anyone wanted to uplift before we log off for the day.
Taylor, can I connect with you offline after? Because it's about the flyer for the community health needs assessment.
Yes, I will give you a call.
Okay, perfect.
Any other announcements? Alrighty, well, thank you everyone for your participation today. Thank you so much, David and Anya, for your overview and presentation, giving us ideas for next steps. We'll be working hard in the background to keep everyone updated and informed with those next steps as it relates to organizing our thoughts. But otherwise, we will reconvene on Thursday, April 17th at our usual 3 p.m. hour.
Thank you. Have a good one.
Thank you, everyone. Have a good
Thank you.
evening. Thank you.
Thank you.
Have a good weekend.